Hello again. Since you're here and invested in PCIT, let's talk about how you can get the most out of it. Before I do that, let me tell you what to expect from PCIT because I think this will help you understand. At the beginning of PCIT, our goal is to really understand what's going on with you and your family. Once we really understand all of this, that's when we start working with you and your child together to help you make changes. But the beginning part is really assessment. So we're going to have a detailed intake session where we're going to learn all about specifically what's going on with you and your child and your family. And then we're going to watch you and your child interact together. And then we're going to teach you the skills that you're going to use in the treatment itself. Once that part is over, that's when we start watching you and your child interact and coach you in the moment so that we can really help you make change quickly. One mistake that families sometimes make is that they expect to see change before we actually start truly implementing the treatment. And that doesn't make sense to expect. It's like going to a personal trainer, having them do a really thorough assessment, and then want to see improved muscles before you've actually sat down at the equipment. So some families start implementing some things right away on their own, and they do see that change. But you really want to give it a couple of coaching sessions before you should expect for things to be completely different. Now, depending upon you and your child, sometimes people do see change after only like 1 or 2 coaching sessions. Sometimes families really need to get to the second phase of treatment, which is about setting limits and learning how to give directions in a way that kids understand. Sometimes they need to be there in order for the change to really happen. But the most important part is to really just allow the process to unfold, to trust in the process a little bit, to understand that this is an evidence-based treatment with over 40 years of research, and that the treatment takes a little bit of time. So that's the first thing to really think about. The second thing I would really recommend that you do is approach treatment with an open mind. PCIT is going to ask you to do things a little bit differently than you currently do them. And that's because kids don't come with manuals. Wouldn't it be nice if they did? But they don't. So instead, we're teaching you evidence-based parenting strategies, and we're going to want you to speak a little bit differently. We're going to want you to approach things a little bit differently. The style of play we're going to encourage is probably not how you're already playing with your child. That's no judgment on you. But what that does mean is that it's going to be a little uncomfortable at first. And so approaching it with an open mind, being willing to try some new things is very important. And it's really common for parents to say to me, originally, when you told me to play with my child like this, I thought that it wouldn't be helpful at all. And now I can see that that is what changed everything. And I'm like, exactly. But it's hard for you to see that when you're starting it at the beginning. The third thing I'm going to encourage you to do is really practice these skills. If you want to see change, you have to put in the reps, just like using our personal trainer example. You have to go to the gym. You have to work out in between your personal training sessions. So we're recommending every single day of doing this 5 minutes of playtime. But at the very lowest you can get away with in order to see real progress is 3 times. So you want to practice 5 to 7 times. 3 is pretty much the lowest you can do if you expect to see change. The last thing I'm going to really encourage you to do is when you start seeing these improvements and get really excited, still finish your treatment. Sometimes families are like, this is great. I've seen this improvement. Let's just stop where we are. And the problem is then you just haven't had enough practice yet to make the changes really, really stick. So you want to wait it out. You want to do the sessions that are helpful to you, talk with your therapist, work together and figure out how long you need to be there. But we do have our own benchmarks for making sure that you really, really understand the skills, that you're able to deliver them, and that you're confident enough at the end of treatment to keep implementing them. And we also keep track of behavior change. So we want your child well within normal limits of behavior before we graduate you from the therapy. So have that discussion. Don't just see the positive results and stop too early if you really want to maintain these outcomes. Some families have told us that they really love doing PCIT intensives. So doing PCIT more than once a week because then you see more progress more quickly. And that makes a lot of sense when you consider that it's not the amount of time or weeks you're in PCIT that makes a difference. It's really the amount of coaching sessions you get in there. So a lot of families are like, let's speed this up. Instead of doing the 12 to 20 sessions of PCIT that it normally takes in 12 to 20 weeks, let's condense and see how quickly we can get this done. And that tends to work exceptionally well. Well, I'm very excited for you. Our team is here for you. If you need anything, please feel free to email us, to text us, to call us, and we will do everything we can to help you have an amazing experience. And again, I'm just really excited for you to see what's on the other side of this.